Healthcare Surrogates: Integrating Law and Ethics by Lori English, Nathan Winterburn, and Colin Rabach. A 32-year-old woman was admitted to the trauma intensive care unit following a motor vehicle accident. She had multiple injuries and fractures with several complications, which continued to develop over the first couple of weeks. The patient entered a comatose state that night at the hospital and was placed on a ventilator. Shortly after the patient's admission, her soon-to-be ex-husband was unable to be contacted. Thus, the second emergency contact, the patient's parents, were contacted and remained vigilant at her bedside. They reported the patient was 1 month away from having her divorce finalized and relayed their concerns. The patient's husband was reportedly physically and emotionally abusive to her throughout their 5 years of marriage, and she had been recently admitted to the ER for facial bruising and a laceration that required stitches. Despite the nearly finalized divorce and apparent abuse, he is her current healthcare surrogate and insists he can and should make her medical decisions. After reading this case, there are overarching questions which need to be addressed in order to conduct a thorough analysis from all viewpoints. Question 1. Given the known abuse, should the husband be responsible for treatment decisions which the patient cannot make? Question 2. What are the ethical and legal parameters regarding this case?
In order to analyze this case from all sides, it is best to disconnect the issues through the perspectives involved. With that being said, the parents, the husband, and the hospital's perspectives are all utilized and taken into full consideration. It is understandable that they have no desire to keep the patient's current healthcare surrogate in control of her medical decisions. The parents do have the ability to make a petition for temporary guardianship, which would allow them to have authority to make medical decisions for their daughter, the patient. However, to do this, a petition for guardianship is required to do so. Given the known abuse history with the husband, it is likely that they would grant temporary guardianship for the parents until the daughter's divorce was final. Then the surrogate and the power of attorney could be reassigned after the divorce went through. This would allow the parents to gain power and make medical and financial decisions on behalf of their daughter. The patient has a right to autonomy. Her parents have the ability to make medical decisions on her behalf, may be interpreted to be in violation of her own rights to make her own decisions. An ethical dilemma that is present in this case is that between the parent's right to make her medical decisions and her inability to express her desired treatment plan. If the parents are granted guardianship for their daughter, they are obligated to make the medical decisions to the best of their ability to what their daughter would have wanted. They are responsible to make this decision with their daughter's best interests in mind. Until the parents receive guardianship for their daughter, they will not be allowed to be involved in any part of the treatment plan. They will not have any say in the treatment plan, and this means that they will be not allowed to make any medical or financial decisions until they are granted that temporary guardianship. Any decisions made about the patient's care plan should be made according to the principle of beneficence, which is a principle of doing good. Until the legal issues within this case are addressed, the soon-to-be ex-husband will still remain the patient's healthcare surrogate.
In this case, the husband would be appointed as the surrogate who would make the decisions regarding his wife's health and finances. The husband needs to follow certain rules when making decisions for his wife that include making decisions in accordance to her wishes, morals, and beliefs. If the husband does not know his soon-to-be ex-wife wishes, he must make decisions regarding her health in the best interest for her. The fact that the wife has not previously determined a medical proxy leads the physicians to have to pick one on her behalf. The selection process starts at the top of the list and continues down until each category is met. The physician begins with the spouse and continues to adult children, then the parents, adult siblings, adult grandchildren, and lastly, adult friends. Some concerns may be raised due to the fact that the wife has been hospitalized for apparent abuse and the couple is in the process of a divorce. If the hospital does not question his ability to make decisions in regards to his soon-to-be ex-wife's health, he will be able to continue as the medical proxy and make all decisions until the divorce is finalized. Although there is an unfortunate case of abuse within this, the husband does not have legal rights obtained from the marriage. Had his wife been competent, she may very well have removed him as her healthcare surrogate. Although some may not deem him capable of making these decisions on her behalf, legally he is still entitled until further action or the divorce is finalized.
Although this case study is not necessarily a right-to-life issue, the case of Terry Schiavo shows similar patterns regarding the legal battles between Terry's spouse and her parents. Although they were defending Terry's right to live, or her right to die, they were ultimately attempting to decide who should be given the right to make decisions on Terry's behalf. The principles of both ethic and legal factors involved in making this decision align with our case in similar ways. Let's take a look back on Terry's life.
We're going to take a closer look tonight at a man's fight over a decision to allow his incapacitated wife to die.
From 2003 to 2005, one woman's story captivated the country.
Terry Schiavo,
spurring a national debate over the right to die.
To deliberately starve her to death is an act of cruelty, and ultimately it's murder.
And the role of government in private life.
Give Terry water! Give Terry water!
On the week of the 10th anniversary of her death, a look back at the defining moments of the Terry Schiavo case.
Terry collapsed one morning in 1990. Her heart had stopped.
When she finally opened her eyes, doctors said she was not conscious. Over the next several months, she went from rehabilitation centers to hospitals and back again, each day getting occupational and physical therapy. A battery of tests, including MRI scans, showed brain function remained significantly impaired.
After years of effort, Michael Schiavo agreed with doctors that there was no hope for recovery.
Terry has made the same movements, the same noises, the same sounds for 13 years.
Her parents felt otherwise.
Please, please, please save my little girl.
So the decision to end her life was debated in the courts and in the State House.
Who's going to look out for this girl's rights? We have to.
We don't make laws in this state based on emotion.
Jeb Bush pushed to keep her alive.
The governor of Florida says a comatose woman will not be allowed to die. He will order her feeding tube put back in.
But the court But the courts overruled the Florida law.
Florida's Supreme Court struck down as unconstitutional a law passed to keep a comatose woman, Terry Schiavo, alive,
encouraging members of the U.S. Congress to take up the charge.
Congress has jumped into the case of a brain-damaged woman in Florida today.
And this judge in Florida want to pull her feeding tube and let her starve for 2 weeks. That is barbaric.
A woman's life is at stake.
And even the president.
In extraordinary circumstances like this, it is wise to always err on the side of life.
But the courts prevailed.
Terry Schiavo's family and their supporters desperately search for a way to force doctors to reattach the tube. It is increasingly clear that the courts will not willingly do that.
And her husband was allowed to remove the feeding tube.
Terry Schiavo has died. The saga is over. The debate about life and death continues.
10 years later, we remember the woman that made the nation ask,
who decides whether a person who cannot decide for themselves lives or dies?
The hospital may determine the ex-husband to be an insufficient healthcare surrogate. In this case, an ethics committee would be appointed to aid in identifying a surrogate decision-maker or to facilitate sound decision-making. The implementation of an ethics committee provides a more thorough process to better ensure accountability, objectivity, and independence. This team can better offer various perspectives and can utilize an array of both medical and ethical considerations whereas a single decision maker may not. Concern that the decision made by the healthcare surrogate will be based upon personal biases are diminished through the use of a committee. A committee is more likely to view a patient as an individual while being mindful of medical benefits and burdens. The underlying goals of traditional ethics committees are to promote the rights of patients, shared decision-making between patients and their clinicians, and fair policies and procedures that maximize the likelihood of achieving good, patient-centered outcomes. Although these committees serve to enhance the ethical environment for healthcare professionals and healthcare institutions, there are a few drawbacks. Time is of the essence, especially in the case of a comatose patient. There are adverse effects of group dynamics in which committees are susceptible. Committees may have more political power than is appropriate. It is of great importance to weigh patients' understanding and choice within the context of the risks and benefits of the medical and interpersonal factors. Good policies should prevent hospitals and physicians from needing a court's opinion in all but extreme cases. The ethics committee could become the target of litigation, either from a patient or family member who is dissatisfied with the consultative process or advisory opinion. There are several gray areas regarding recommended action that could be considered a violation to the patient's legal rights. Treatment against a surrogate's wishes is likely a possibility. While ethics committees will likely face some risk of legal action, clear professional and institutional standards for their constitution and operation would reduce that risk.
We as a group think it is very important for individuals to have the knowledge regarding healthcare surrogates when they are in the capacity to make decisions. So in this particular case, we believe it is very important for the wife to make a decision while in the process of going through a divorce to appoint maybe a different healthcare surrogate, such as her parents, a friend, a brother or sister, in order to tackle the situation before it reaches an incapacitated state. This will allow the patient to reach maximum healthcare benefits while in the incapacitated state, and it will also take less responsibility out of the hospital, the parents, the husband, in order to try to determine who would be the best surrogate. By having the wife or the patient determine the surrogate during the divorce process, it will also allow her to voice her opinion on her healthcare decisions if she were in the incapacitated state, and it will also make sure that the appointed health surrogate will know and her best wishes to determine her future healthcare decisions. Any standard for capacity to appoint a healthcare surrogate must also take into account the relative risk and burdens. Ongoing collaboration between clinicians, legal professionals, and research will further elaborate appropriate methods for assessing the capacity of the patient to appoint a healthcare surrogate. The further elaboration will facilitate optimal clinical care for vulnerable adults, focusing on the treatment plans that best benefit the patient. Evaluation of the capacity to appoint a healthcare surrogate are an important area with regards to healthcare. The presence of diminished capacity to make healthcare decisions will continue to grow because the baby boomers population is approaching older age, with increasing prevalence of dementia and other factors affecting their cognition, which could ultimately lead to incapacitation. In order to assess the capacity of the patient to appoint a medical proxy, the patient's understanding of what it means to give surrogate authority needs to have careful consideration in a clinical setting. The patient needs to have full understanding of what it means to give the surrogate authority to another individual. The adequacy of the patient's abilities in these functional areas may be weighed in the context